The health department reported 777 new COVID-19 cases on Saturday, the highest daily tally in over 3 months. Let's talk more about this with OCTA Research Fellow, Professor Guido David. He's joining us over the phone. Professor Guido, good evening.
Hi, good evening, Risa.
Professor, first off, how significant is the recent increase in fresh COVID-19 infections?
Well, the increase is actually significant because although cases have been rising since early May, the increase in cases has been limited to about 10% every week. That was back in May. But now the cases are starting to, the rise in cases is starting to accelerate. So now we're seeing about 80% one-week growth rate. So that means cases are increasing about 80% every week. So of course, this means that the rise is significant, but the level of cases is still relatively low at this time. 777 cases is still not yet at an alarming level. We're still below 1,000 cases per day, although we're projecting that we'll probably be over 1,000 cases per day, possibly this week.
Professor, as to what factors are we looking at behind this uptick in COVID-19 cases?
Well, definitely there's the factor of the new subvariants, the Omicron BA4 and BA5, and studies have shown in other countries that these subvariants are more transmissible compared to Omicron BA2, which was the variant that spread in the Philippines back in January. And it's also showing that these subvariants have some level of immune escape. So that means even vaccinated and people who have already contracted the virus previously may still get infected. At what level it varies. And then there's also the factor that people are more complacent now, and we also have waning immunity as a factor.
Sir, do we have information as to which areas are now seeing a significant increase in infections?
Well, Risa, it's generally in the NCR area and near NCR. So we're seeing an increase in cases in Calabarzon, particularly in Rizal, Batangas, Cavite, and Laguna. We're also seeing an increase in cases in Western Visayas, like in Iloilo. And then also a slight increase in cases in Benguet. But there are a few other areas that are now seeing an uptick in cases, which may progress to an even more significant rise in cases.
Professor, we're seeing these numbers every day. Can we say that this is perhaps the start of an impending surge? What are the projections from OCTA?
Well, we think that this is already we think that this mini surge or this week surge has already started. It started possibly around last week or 1 to 2 weeks ago. And what we're seeing or what we're projecting is that the cases could peak around first or second week of July, and we may be seeing up to a few thousand cases, like 2,000 or 3,000 cases per day in the whole Philippines.
Would you recommend, Professor, that perhaps the government impose a lockdown again?
Well, lockdowns are out of the question, especially with the economic challenges and hardships that we are facing right now. But even escalating to alert level 2 is probably not warranted at this time. Like I mentioned, we have several challenges economically. And so, and we have a lot of vaccinations in the country. So the best way around this is to try to live with the virus, especially since the projections show that the number of cases is not projected to increase at significant or very high levels. If we have a few thousand cases per day, that's very, that's actually very low compared to the previous surges wherein we had almost 40,000 cases in one day back in January, and last year we had up to.
A question, sir, what would or what should the government and the public do in order to prevent another surge of happening?
Well, definitely vaccines and boosters help. So we still have a low level of booster coverage. I think only 14 million Filipinos have taken their first booster shot. and vaccines are available. So I would recommend the public to take the first booster shot. And of course, just practicing health and safety measures like wearing face masks and other health protocols will help stop the rise in cases, or at least help mitigate the rise in cases. And for the government to continue to monitor, especially since we'll be having a transition, we'll be having a new government in a few days. And the way I've seen it, the new government is already taking steps for planning and for the preparing the advisory committees and advisory groups that will help us manage this continuing pandemic of coronavirus.
Well, thank you. As always, that was OCTA Research Fellow, Professor Guido David.